Okay, so treatment from us, the acupuncture community. I guess we've got people listening who are all different levels of experience, so I hope you'll forgive me if this it seems patronising. It's not meant to be, but if you haven't been treating many pregnant women with sickness, you just need to think about a few other things that are different to when you're treating non-pregnant women. What's different when you're treating pregnant women with sickness versus somebody else who's got nausea for other reasons? Well, position. Pregnant women are prone to postural hypotension because of the baby leaning on the inferior vena cava. Their blood pressure can drop quite easily when they're lying down flat. Now, most of these women will be early pregnancy, so this wouldn't be a problem. But some of these women do have sickness going on later on, so it's just something to consider. And actually, if you're feeling sick, you don't always want to lie flat anyway. You might want to be sitting up. I don't like treating pregnant women sitting in a chair personally because of this tendency to sometimes faint. So I always feel happier having them lying on a couch. Ventilation is important. We talked earlier on about their increased sensitivity to smell. So if you've got cooking smells around your clinic, maybe if you're working in a multidisciplinary clinic, you might have colleagues heating up their lunch, and this can be very off-putting, or moxa smells. You need a bowl handy just in case they suddenly vomit, because they just sometimes don't know when it's coming, and you need tissues and water for them. You can be taken by surprise. I've put not left alone, and again, you know, when these women are feeling really rough, depending on how you work in your clinic, they do need to be able to call you if you're doing a multi-bed type treatment. Generally, I think it's a good idea to focus on the problem in pregnancy. When they're feeling this rough, they just want you to sort out their sickness. If they also have certain other conditions, yes, of course, if it's part of their TCM pattern to do with their sickness, but I think generally it's important to sort out their nausea and vomiting, and then not to try and do too much in one go. I think generally pregnant women respond absolutely fantastically to acupuncture. They're fit young women on the whole. They don't need strong needle technique. Gently tonifying or reducing the needles according to what you're asking the acupuncture point to do, of course, or even methods if in doubt. But I just don't think they need really strong needle techniques. Frequency of treatments, what's ideal and what's practical? Well, you can see patients with hyperemesis daily, and there are studies where it's been done even more than that. But obviously you need to use your common sense, because it depends, of course, if they're in hospital, whether you can actually get there. But if they're not that bad and they're coming to see you from home, then certainly you can see them daily, alternate days, 3 times a week, whatever. And in terms of, again, we have an issue with charging versus non-charging in different countries, but you can find your way around this by, it's more important that you get them better and give them frequent treatment, I think. And if they have persistent vomiting and they're not improving at all, and you're worried that they might be getting dehydrated, then they may well have hyperemesis and need referring. Okay. From the TCM perspective, what's going on? We think that nausea and vomiting in pregnancy is due to disorder in Chong Mai, the penetrating vessel, leading to rebellious qi, and this affects the descending of stomach qi, which leads to nausea and vomiting. There are huge changes in pregnancy, as we know, 30% increase in blood volume in the very early days of pregnancy, massive changes. The menstruation stops and the blood goes to nourish the fetus when the woman is pregnant, and some rises up to the chest to make breast milk from the TCM perspective. And it's thought that this big change in chi and blood balance plays some part in nausea and vomiting of pregnancy. There seem to be certain patterns of disharmony, stomach chi shu, spleen chi shu, stomach deficiency with cold, stagnation of liver chi invading the stomach heat, accumulation of phlegm, heart chi deficiency and heart fire. So if the patient in front of you has a predisposition to these conditions, then they may well become worse during pregnancy and hence end up with nausea and vomiting. And so you're already, if it's a patient you've been treating before she got pregnant, particularly for perhaps infertility, you're well familiar with her TCM background, then you're already one step towards being able to help her. Unfortunately, people don't fit into nice neat boxes, do they? So you may well have more than one pattern going on. Stagnation of liver chi is quite important, and of course the huge emotional aspects associated with getting pregnant. This woman might be very angry that she's pregnant. She might not have planned her pregnancy, and there may be all sorts of things going on at home where her partner might not want her to have a baby, or various other stresses, which I'm sure you don't need me to go into. But if you have somebody walking in who's fed up and really angry that they've got pregnant and it's going to affect their work and all of these type of attitudes, then you know, you're going to be expecting some kind of stagnation of liver chi going on. And then of course you have the other syndromes which may well be to do with diet, being overweight, etc. Poor diet in the past or currently in early pregnancy. So just building that picture of your pregnant woman like you would with anybody else. You know, what are you seeing? What are you getting from tongue and pulse, etc. So to break that down a bit more into treatments, the woman with stomach chi shu is going to have nausea and is likely to be vomiting clear fluids. She's going to have a tongue that's pale, and the sort of points you might consider. These are just suggestions, things I've found useful. Of course there are others, but pericardium 6, Ren 13, stomach 36 might be useful here. If it's spleen chi deficiency, she's going to have chi shu symptoms. She's going to be tired, have tired limbs, again a pale tongue with maybe a bit flabby with teeth marks. Sort of points will be bladder 20, pericardium 6 again, and Ren 12. Just suggestions. Stomach deficiency with cold. She's going to feel cold. She's going to have a pale tongue again. Points as above, but you may want to consider adding moxa to Ren 12 and stomach 36. These women actually find the moxa really comforting to Ren 12. They really like having their tummy warmed. And stagnation of liver chi invading the stomach. As I said, she's going to be likely to be irritable, bitter taste in her mouth, and a retching type of pattern, and the tongue may have raised sides. Sort of woman who might have had terrible PMT before she got pregnant, perhaps. Liver 3, fantastic for stagnation of liver chi. Pericardium 6, Ren 12, 13 and 14. You don't have to use all of them, but they would all be good points in that particular pattern. The woman with stomach heat, she may well have heartburn and she's likely to be quite thirsty. She's going to have a red tongue, and points like stomach 44 to reduce stomach heat, pericardium 6 and Ren 12 might be useful. If she has an accumulation of phlegm, when you ask her about what happens when she's sick, she may say it's very frothy and very phlegmy, and she also has an increase in saliva. And as I said earlier on, this can be actually very dramatic in some very unfortunate women. And she's likely to have a coated tongue, as you'd expect to see with phlegm. Stomach 40 is a great point for phlegm. Bladder 20, tonify the stomach and spleen. And pericardium 6 and Ren 12. If she has heart Qi deficiency, heart fire, she's going to have anxiety, insomnia, and possibly vivid dreams. Tongue might be red at the tip, and points like Shen Men, heart 7, pericardium 6, Ren 12 to 14, you can choose one or two of these. And you'll probably notice that pericardium 6 comes into all the different syndromes. So if in doubt, pericardium 6. And sometimes it's useful to suggest to women that they might try acupressure, so using C-bands to pericardium 6. Very easy to wear, easy to get hold of, I'm sure, everywhere in chemists, and they're used a lot for travel sickness and seasickness. One little thing I've found with these seasickness bands, though, is that very often women haven't got them in the right place, so they may walk into your clinic wearing them, and it's worth you looking because they should be very tight. They should have a red indentation where they've been wearing them, and if they haven't, they're not tight enough. They need proper acupressure to pericardium 6. So make sure it's in the right place between the tendons, because it's often not, in my experience. It's moved, or they've bought them from the chemist and don't know exactly where to find the point, or they've been given some by somebody else and the elastic has become loose. Some women, of course, have very small wrists, and it may be worth trying to get hold of pediatric C-bands. You can get children's version of these, and with women who are tiny, this will actually put enough pressure on, otherwise it won't help. The other tip I say to women wearing these is that it's worth wearing them when they feel rough, but take them off when they're feeling good, because I think they build up a tolerance to them otherwise. So put them on intermittently or before the time of day when they know they're going to feel worse. Most women know that they feel terrible when they wake up in the morning and they throw up, and then they feel a bit better and manage a bit of breakfast hopefully, and then they'll be okay until the afternoon, and there's this sort of link with getting tired and being worse at the end of the day. So in terms of, thinking about it, maybe just put their C-bands on early afternoon before the nausea builds up again. Just a little tip.